Hi friends, I am Dr. Pratap Snato. I have done the MD in Forensic Medicine. Today's video will continue with sedative types of poisoning, sedative and hypnotic type of poisoning. In that, we will discuss about hydrocarbons, poisoning from hydrocarbons. Hydrocarbons are a group of compounds which are derived from petroleum distillates. There are three different types of hydrocarbons. One is aliphatic hydrocarbons. In that, it includes gasoline, naphthas, mineral spirits, kerosene, butane, propane, turpentine, paraffin wax, petroleum jelly, tars, asphalts, minerals, mineral oils, seal oils. Among them, kerosene, turpentine are easily available and household cleaning agent. Turpentine kerosene is also used for cooking purposes in villages, and turpentine has a cleaning agent. It is commonly used, so poisoning is common. Next is halogenated hydrocarbons, which includes organochlorines, methyl bromides, fluorocarbons, methylene chlorides, carbon tetrachloride, trichloroethylene, and tetrachloroethylenes. Next is aromatic hydrocarbons. These are includes benzene, toluene, xylene, and naphthalenes. So naphthalene, again, it is available as naphthalene balls, or also known as moth balls, which are placed in household as a to as a form of insecticides. Coming to absorption of hydrocarbons, turpentine and phenol are products of wind distillates and are readily absorbed from GIT. Toxic substances like gasoline, kerosene, naphtha, mineral spirits, lighter gas oil, mineral seal oil are poorly absorbed from GI tract. So few hydrocarbons like turpentine and phenol are absorbed from GIT. Others like gasoline, kerosene are poorly absorbed. Benzene, toluene, xylene are highly volatile and well absorbed from the GI tract. Methane, butane are gases and they usually act as asphyxiants, so it prevents the oxygen absorption. LPG is just a mixture of butane and propane and it is also toxic. Then lubricating oils and asphalts are non-toxic. This group of hydrocarbons are usually non-toxic. Coming to signs and symptoms, acute or chronic contact with hydrocarbons causes chronic enzymatous dermatitis with redness, itching, and inflammation. If they comes in contact with the skin, usually causes dermatitis. Cutaneous exposure to gasoline and other hydrocarbons can cause second-degree burns, systemic and manifestations. Fever may also be present. Then pulmonary symptoms includes gasping, coughing, choking, which indicate aspiration. There may be nasal flaring, intercostal interaction, dyspnea, tachypnea, and varying degrees of cyanosis are seen, which are again because of asphyxia. If severe injury occurs, pulmonary symptoms progress up to 48 hours with complete resolution in 3 to 5 days. In CNS, they cause depressive effects, somnolence, that is, person goes to sleep, dizziness, convulsions, and coma. Eye, there is photophobia, redness, transient corneal irritation. Cardiac abnormality is rare, which commonly after injection it is very rarely seen. During solvent abuse, especially with chlorinated and fluorinated hydrocarbons, sudden death secondary to dysarthmias can occur. So solvent abuse is a form of drug abuse where the person tried to inhale the solvents like xylene and butylene or which are abused. They inhale those chlorinated or fluorinated hydrocarbons, which may sometimes lead to sudden death secondary to dysarthmias. Methane or butane inhalation causes hypoxia and can cause CNS symptoms, but lungs are spared. Gasoline, turpentine, and naphtha are aspirated and can cause CNS depression, but effects of GI absorption are not significant. Petroleum spirits, kerosene, mineral seal oil can cause pulmonary complications. Lubricating oils, mineral oil, asphalt are non-toxic but may cause lipoid pneumonias in case of direct aspiration. CNS toxicity following ingestion appears to be indirect and secondary to pulmonary involvement. Fetal dose is 30 to 100 ml of kerosene, 50 to 20 ml of benzene, so which are commonly poisoned. Fetal period is within 1 day. Chronic exposure to hydrocarbons like benzene is considered as a human carcinogen, which may lead to the cancer formations. Some hydrocarbons can cause aplastic anemia, myocytic and monocytic leukemia, which also been reported. Toluene inhalation is associated with renal tubular necrosis and peripheral sensorimotor neuropathy. Treatment: the person should remove from the contamination, like clothing should be removed, wash the affected area with soap and water. In ocular exposure, prolonged irrigation with stellar solution is to be done. Gastric evacuation is indicated for camphorated products, hallucinogenic products like methylene chloride, carbon tetrachloride, aromatic hydrocarbons like benzene, toluene, and aniline. Ipecac induces emesis preferred over lavage. Usually, gastric lavage is not useful. Ipecac is useful preferred. Then gastric evacuation is for pure petroleum distillates or turpentine injection is not recommended. Also, kerosene also it is not recommended. Only in these compounds like amphorated products, hallucinogenic and aromatic hydrocarbons, stomach wash is indicated. Activated charcoal has limited value. Cataract may be given. Continuous positive airway pressure or positive end expiratory pressure or high frequency jet ventilation is beneficial in severe poisoning. Absorption of ingested kerosene can be slowed by giving 250 ml of liquid paraffin orally. Then corticosteroids are given to reduce the inflammation caused by the hydrocarbons. Postmortem appearance, signs of asphyxia is present. There may be acute gastroenteritis and the odor may be present in the lungs and alimentary canal. The peculiar odor of whatever the compound the person has consumed may be present. There may be atelectasis, intestinal inflammation and necrotizing bronchopneumonia may be present. The pleura and cut surfaces are deeply red or purple, oozing a blood stained watery or frothy fluid. Petechial hemorrhages, larger hemorrhages into the mucous membrane and subserous tissues may be found in the trachea, gastrointestinal tract and elsewhere where it presents. Cloudy swelling and fatty genesis of the liver and kidney may be seen. In toluene poisoning specifically, the red cells may show basophilic stippling. So, in cases of toluene, the basophilic stippling of RBCs are present. Circumstances of poisoning. Poisoning is usually accidental, especially among children. The children may mistake for any syrup and drink it. Adults may be accidentally poisoned by drinking it by mistaking for country liquor. Suicidal poisoning is very rare. They are not used for homicidal purposes. Sometimes in siphoning of gasoline from tank, the mobile liquid can be aspirated into lungs and can cause death. Coming to turpentine poisoning. Turpentine again is a hydrocarbon obtained from distillation of oleoresin from various species of pine tree. When fresh, it is colorless. It is extensively used to dissolve varnish paint and grease stains. It is eliminated from lungs and breath and has a characteristic smell. In urine, it is excreted in combination with glucuronic acid. Some amount is also excreted by the skin. Signs symptoms: skin, it causes redness, itching and vesiculations. GI, it causes nausea, vomiting, colic pain and diarrhea. Respiratory system is antidepressant and pneumonia it can cause. CNS, it can cause excitement, giddiness, delirium, convergence and coma. Renal, it causes albuminuria, hematuria, oliguria and renal failure. Fetal dose is about 150 to 200 ml. Fetal period is 1 to 2 days. Treatment: gastric lavage with weak solution of sodium bicarbonate. Then demolition treatment is preferable. Then supportive therapy is given. Postmortem appearance: stomach wash. Stomach shows hemorrhagic spots and contains smell of turpentine. Lungs, brain and meninges are congested again because of asphyxia. They are congested. Kidneys may show degenerative changes. Circumstances of poisoning: it is usually accidental. Suicidal is not present. Abortifacient also sometimes it is used because it is easily available. It may be fed for causing abortion. Coming to naphthalene. So, naphthalene is again commonly available and easily available in households. It is also called as mothballs, which contain naphthalene or para-dichlorobenzene. Symptoms are nausea, vomiting, diarrhea, abdominal pain, fever, headache, confusion, sweating, dysuria, convergence and coma. It can cause hemolysis in patients with glucose 6-phosphate dehydrogenase deficiency and acute renal failure. Fetal dose is 2 to 5 grams of naphthalene balls. Chronic exposure to naphthalene can result in aplastic anemia and hepatic necrosis and jaundice. These are my references. Thank you.